Hello, and welcome to the Public Health Shift audio edition. I'm Nadia. In this space, I read and reflect on each issue of my newsletter, creating a pause for public health professionals to think more deeply about how we work, what we prioritize, and what the current moment is asking of us. This episode is based on issue 29. What actually changes when you move from practitioner to consultant? In this episode, I want to discuss something that comes up frequently in conversations with public health professionals who are considering consulting as the next step in their careers. Many practitioners assume that the transition into consulting is primarily about learning how to translate their expertise into consulting services, and to some extent, that reasoning is understandable. Organizations hire consultants because they need technical support, specialized skills, or additional capacity. It is therefore easy to assume that consulting simply involves applying existing expertise in a different setting. But when I speak with practitioners who are transitioning into consulting, the challenges they describe are rarely technical in nature. More often than not, they relate to mindset. While practitioners and consultants may draw on many of the same skills and areas of expertise, they do not always occupy the same position within the system. This means that the way they engage with problems, decisions, and outcomes can differ significantly, and this implies adjustments when moving from practitioner to consultant. One of the first adjustments relates to context. Practitioners often spend years building knowledge within an organization, a program, or a health system. Over time, they develop an understanding of formal processes, informal dynamics, stakeholder relationships, and organizational history. They know what has been tried before, where sensitivities exist, and how decisions are typically made. Consultants, on the other hand, rarely have the luxury of acquiring this knowledge gradually. Instead, they are often expected to understand enough about a context in a relatively short period of time to provide useful advice, to facilitate decisions, or to support implementation. Of course, this doesn't mean becoming an expert in every context, but it does mean learning how to ask the right questions, how to identify what matters most, and how to build an understanding of the environment quickly enough to contribute meaningfully. For many new consultants, this is one of the first mindset shifts. Another shift relates to ownership. Practitioners are typically embedded within the systems they serve. They are responsible for programs, teams, activities, budgets, and results. They live with the consequences of decisions and often remain involved long after those decisions have been made. Consultants occupy a different position. They contribute analysis, recommendations, and perspectives, but they do not own the final decision, nor do they usually control implementation. And this can be challenging for professionals who care deeply about outcomes. A consultant may conduct a thorough assessment, facilitate extensive consultations, and develop recommendations that are both evidence based and practical. And yet, the client may ultimately decide to pursue a completely different course of action. And this doesn't necessarily mean that the advice was poor or that the work failed, but clients must balance considerations that extend beyond the consultant's remit. They have to navigate political realities, organizational constraints, stakeholder priorities, funding considerations, and institutional risk, which all have an influence on decision making. One of the adjustments that many new consultants struggle with is recognizing where their responsibility begins and where it ends. Because the goal is not to make decisions on behalf of clients, it is to help them make informed decisions for themselves. And this requires a degree of professional detachment that can feel unfamiliar to practitioners who are used to owning outcomes directly. At the same time, consulting does offer something that practitioners sometimes find difficult to access from within an organization. Since consultants are not embedded in the same hierarchies, reporting structures, or institutional dynamics, they often have a different vantage point from which they are able to observe challenges and opportunities. Of course, being external does not automatically make a consultant right, nor does it replace the expertise and experience of those who are working within the system. But it can create space for questions that internal stakeholders may not always have the opportunity to ask. It can allow assumptions to be examined, trade offs to be discussed openly, and alternative perspectives to be introduced into the conversation. And this is one of the reasons why clients often seek external support even when they already possess considerable technical expertise internally. They are not just seeking knowledge, they are also seeking perspective. Many public health professionals considering consulting understandably focus on practical questions. How do I find clients? How do I price my services? How do I write proposals? And while these are all valid and important considerations, the transition into consulting is not simply an operational shift. It's also a cognitive one. It requires becoming comfortable with ambiguity, learning to build context quickly, developing recommendations without owning implementation, and creating value in environments where you may only be present temporarily. Of course, technical expertise remains essential. In most cases, it is what creates the opportunity to consult to begin with. But long term success depends on something more. It depends on learning how to operate effectively in a different role within the problem solving process. Before I close, I would like to leave you with a few questions for reflection. How much of your current effectiveness depends on knowledge of your organization, program, or system? How comfortable are you operating in situations where the problem itself is not yet clearly defined? How would you react if a client chose not to follow a recommendation that you strongly believe in? What value could you bring to an organization beyond your technical expertise? And which aspects of consulting feel most exciting to you and which feel most unfamiliar? Over the years, I have met many talented public health professionals who were more than capable of consulting from a technical perspective, but who had never been exposed to some of the practical realities involved in making the transition. This is one of the reasons that led me to create the Public Health Consulting Essentials course. If consulting is something you are actively considering, the course is designed to help you navigate that journey. In addition to practical topics such as defining your services, finding clients, pricing your work, and writing proposals, it also explores the mindset shifts required to transition into consulting. I've included a link to the course in the episode description for those of you who'd like to learn more. Consulting is often portrayed as a natural next step for experienced professionals, and in many ways it is. But the transition involves more than just applying expertise in a different setting. It requires learning to navigate unfamiliar contexts, to support decision making without owning decisions, and to contribute from a position outside the system itself. Recognizing these shifts early can make the journey considerably smoother for practitioners moving into consulting. Because, as we've discussed throughout this episode, what changes is not only where you work, it is how you engage with problems, decisions, and the role you play in helping organizations move forward. Thank you for listening. If you would like to continue the reflection, you can read the full version of this issue by subscribing to the Public Health Shift newsletter on www.nadiatekal.com. Until next time, take care and keep questioning how we show up in our work.